Hello, my name's Martin Coburn. I'm a Professor of Orthodontics at King's College London in the UK.
Hi, I'm Andrew Tobias, a consultant orthodontist at the William Harvey Hospital in Kent in the UK.
We're here to discuss the findings of a recent randomised controlled trial investigating the effect of vibratory forces during orthodontic treatment with fixed appliances. Since the introduction of edgewise fixed appliance systems, orthodontic treatment duration has not changed significantly. There are many benefits associated with reducing treatment time, both for the orthodontist and patient, and in recent years a number of techniques have been described that aim to accelerate orthodontic tooth movement and therefore reduce treatment time. A recent development has been the use of supplemental vibrational force, which has been suggested to stimulate metabolic activity in the periodontium and help accelerate orthodontic tooth movement. Based upon this theory, Accellident is a portable vibrational device that has been marketed as an adjunct to fixed appliance treatment, aimed at reducing treatment time when used by the patient for 20 minutes per day throughout their treatment. We decided to test this theory in a large multi-centre randomised clinical trial conducted at King's College London and 3 UK university teaching hospitals. We have previously published results from this trial in the Journal of Dental Research, showing that use of this device has no significant effect on orthodontic tooth movement during the alignment phase of fixed appliance treatment, in Nature Scientific Reports, showing that this device had no impact on pain and discomfort during the first week of treatment with fixed appliances, and more recently in the American Journal of Orthodontics and Dentofacial Orthopedics, showing that this device does not increase external root resorption during the initial stages of treatment. Here we describe the final results from this trial, focusing on space closure, length of treatment and occlusal outcomes. In this randomised trial, adolescent subjects undergoing routine extraction-based fixed appliance treatment were randomised into receiving fixed appliances supplemented with 20-minute daily use of the Accellident device. Fixed appliances combined with 20-minute daily use of a non-functional sham device or fixed appliance treatment alone. All subjects had mandibular first premolars extracted as part of their treatment. The fixed appliances, archwire sequences and method of space closure using nickel titanium coil springs were identical for all subjects. The primary outcome for this arm of the trial was initial rate of space closure in the mandibular arch, while secondary outcomes included overall treatment duration, number of visits, appliance breakages and treatment outcome assessed using PAR scoring.
A total of 81 subjects with a mean age of 14.1 years were randomised, with 29 allocated to the Accellident group, 25 to the sham device and 27 to the fixed appliances only. At the final completion of treatment, 20 subjects have been lost to follow-up. There was no significant differences in baseline characteristics between randomised groups. For all randomised subjects, mean initial rate of space closure was 0.89 mm per month, and the mean total duration of space closure was 172 days, with no significant differences between the groups for either variable. In addition, there were no significant differences between randomised group for overall treatment duration, number of visits, number of appliance breakages, final PAR score or percentage improvement in PAR score. Both crude and adjusted regression analysis found no difference in initial rates of space closures between groups. The only factors that significantly influenced rate of space closure were patient sex, type of extraction in the maxillary arch, and the amount of initial space to be closed. This study found that the use of supplemental vibrational force did not affect rates of extraction space closure, duration of treatment, or treatment outcomes when used in adolescent subjects undergoing extraction-based orthodontic treatment with fixed appliances. No prospective clinical study is perfect, and this is no exception. In particular, we didn't have definitive compliance data relating to device use, and the dropout rate at the end of the study was quite high. However, this was a long-term clinical trial following subjects at the end of treatment, and they were monitored closely for ongoing compliance throughout this time. Despite these limitations, this investigation currently represents the highest quality clinical evidence related to the use of supplemental vibrational force in orthodontic treatment. We would like to thank our co-researchers, particularly Neil Woodhouse, who was instrumental in the organisation of this study, and the editorial board of the journal in allowing us to share our research with you. Please read the full study in the April edition of the American Journal of Orthodontics and Dental Facial Orthopedics.